Was asked specifically by the senator if the COVID-19 vaccine, if the vaccine from Operation Warp Speed actually saved American lives, and how many. He wouldn't answer that either. What message is that coming now from the Department of Health and Human Services?
Well, I think we all know how important the COVID vaccine was. It was scientifically critically studied to prevent severe disease. I think where people started to get confused is when we started to make potential claims that the vaccine did more than what it was studied to actually show.
We have all the vaccines we need. We just need our people to take it. A, for their own protection, for the protection of their family, but also to break the chain of transmission, because there's this feeling, well, I'm young, I'm healthy. If I get infected, the likelihood of my having any symptoms is very low, so who cares? You should care, because if you get infected and you're not vaccinated, there's a chance, maybe a likelihood, that you will be part of the dynamics of the continuation of the chain of transmission. Namely, you will inadvertently or innocently transmit it to someone else, who will then transmit it to someone else. And I don't think anyone would intentionally want to be part of the transmission chain. You want to be a dead end to the virus. So when the virus gets to you, you stop it. You don't allow it to use you as the stepping stone to the next person. So those are the things that we ask people to consider, not only your own health, but your societal responsibility to really knock this epidemic out in this country.
The various shots that people are getting now cover that. You're okay. You're not going to get COVID if you have these vaccinations.
Yeah.
And remember, all of those original studies, we didn't test patients unless they had symptoms. We only looked for disease. And so we don't know how many people were asymptomatic. We don't know about protection against infection. What we did know about is protection against severe disease. And clearly, if you look at the mortality in individuals over 75 before vaccination and after vaccination, there was a dramatic difference, even through Omicron and Delta. So yes, the vaccine was highly effective for what it was intended to do, which was prevent.
Shouldn't the health secretary know that?
You know, I'm not sure that there's so much confusion about the COVID vaccine, what it was studied to do. I just want to make it very clear. It was studied to prevent severe disease, and that's what it does. And then I think the question is, well, who's susceptible to